It's really important to do as many different types of thoracic mobility as possible. So I'm trying to include as many as I can within these videos. So you'll see seated, kneeling, and lying thoracic mobility. And each are going to be different in their own unique way. So we want to make sure that when we are laying, we have something up underneath our head. You can have a pillow, a yoga block. For simplicity, I'm just going to use my foam roller. So head is here. We're going to have our shoulders stacked, hips are stacked. We're going to straighten out the leg. Actually, you know what? I'm going to keep my hips stacked because as soon as I straighten out my leg and move my hips, there's a rotation happening in my pelvis. And I want to try and keep everything perpendicular to the floor and my spine parallel to the floor. So that means I might have to breathe out, pull in, and engage that core at about 10 to 15% of your max. You're not squeezing. If we tend to have hips that still want to feel like they're falling in, you can place a yoga block or a pillow between the knees. So keeping everything nice and neutral. So a feeling of ease in all the rest of the muscles. As we come out into that thoracic mobility, we're going to inhale as we're opening everything up. So you see how I did that? I reached out past my hand. Okay. If reaching out past your hand isn't a thing without feeling like you're falling forward, then just reach out as far as you can. You'll feel that stretch. That shoulder blade will protract away, right? Protract. And then you're going to come up, keeping that elbow. Your arm is straight, but it's not hyperextended or locked. It's slightly bent, so it's soft. You're going to start turning your thumb. You're keeping the arm at about shoulder height or a little bit lower. And notice my head is going to start moving with my body. Keeping that chin tucked so we're not letting it out. That's why you can always place the back of the head. For room wise, I'm going to bend my elbow, but you want to keep it pretty extended. So we inhaled and then we're exhaling and letting our body fall into that place of stretch. Then one of two things, you can either inhale and stay here again for a second release, which is definitely recommended for the first couple times. And then on your inhale, you're going to bring your arm back in so that we're not utilizing too much of that muscle that we just stretched. Pull back in and across. See how much more range of motion. I don't know if you can see that, how much more range of motion I got after just one or two breaths. So you're inhaling here, right? Yoga block's a little bit more stationary for your head or a pillow. And then relax into that. Nothing should be hurting in that lower back. We should force nothing. Inhale again. Big inhale. And then you can have a nice long slow exhale here at the end of that movement. So we're doing in between 5 to 8 per side, remembering that nothing should be forced and nothing should hurt. It should just be a nice opener in through that thoracic upper side. Everything else has a feeling of ease so we can comfortably breathe in and out into that range of motion.